And we've got now to the last session. We have, of course, Mr. Love Agarwal, Additional Secretary, Ministry of Health and Family Welfare, joining for this conversation. This is going to be the last panel discussion for the day. And we're talking about strengthening healthcare infrastructure through technology. It's going to be a fabulous session for sure, and I'll request all of you to kindly stick around for this one and join me in welcoming the last panel for the day. Mr. Praveen Bist, CIO, Amrita Hospitals, joining in for the panel. And I'll request you all to welcome Mr. Bist with a round of applause. Thank you, sir. Dr. Vaibhav Kapoor, co-founder, Pristyn Care, joining us as well in this conversation. Dr. Anirvan Chatterjee, founder and CEO, Haystack Analytics, also joining us for the last panel of the day. To moderate the session, I would like to call upon Neetu Chandra Sharma, Senior Editor, Business Today. I'm hoping that too, sir. The strength in the room is slightly less, I understand, but there are so many people watching us online. So I'll request all of you to join me once again in welcoming the panel on the stage with a round of applause. Can we do that? Thank you. Ms. Sharma, over to you.
Hello and a very warm welcome to all of you, ladies and gentlemen. Technology and generative AI has already transformed our day-to-day lives when we can connect to our doctors sitting at home, and we can also monitor our blood pressure with a smartwatch on the go. Now, what technology has to offer when it comes to strengthening India's healthcare infrastructure, and what the future of healthcare delivery may look like when technology becomes an integral part of it? So I have a stellar panel today to discuss and deliberate upon this important issue. So let me straight dive into it, and I would like to start off with you, Mr. Love Agarwal. Since you have managed the crisis of times, which is COVID-19 pandemic, and in fact the government of India at that point in time rolled out a lot of technological solutions like COVID for vaccination and Arogya Setu for contact tracing and e-telemedicine service e-Sanjeevani. So now what role of technology do you see in managing a crisis like COVID-19, and during this kind of crisis, how do you see technology managing such times?
Thanks, Ms. Neetu. First, at the outset, let me congratulate and thank IAMAI for organizing this workshop focused on digital technologies and specifically on this session on digital health. So, colleagues, I just want to highlight that had it not been for technology, we would not have been able to manage COVID-19 to begin with. India started managing COVID-19 through its not use of data alone, but data-first approach. I would just like to highlight that we had our COVID-19 India portal. You don't hear about it because this was an in-house portal and is still running. That portal became the mainstay of collation of data from each and every district in the country on a daily basis since February 2020. This software, this portal was supported by a multitude of the other initiatives, some of which you have already alluded. Contact tracing supported by Arogya Setu, 220 million downloads. E-Sanjeevani platform, which facilitated when people could not come out of their houses, but they could still get health services, health-related information, and the prescription by a doctor. More than 150 calls have been done till yesterday. Similarly, we are all aware of the public interface of CoWIN, wherein we are aware that 2.2 billion digital imprints of each and every dose given across the country was monitored. Let me also highlight there were other integrated tools which we prepared, and this actually would respond to the point, Ms. Neetu, you mentioned, that if you were to ever manage next health emergency, are we ready? So if you see 913 million tests done in the country, they're all monitored through a RT-PCR and ICMR portal. And this data would come to us on a daily basis, and based on which we were able to identify trajectory of cases, case positivity, and based on case positivity, what needs to be done at any point across the country in any district or in a sub-district level also. Similarly, we had a facility app. We had even monitoring of oxygen demand during one of the wave was done through an IT portal. Based on the oxygen demand, how the movement of the oxygen cylinders needs to be organized, the oxygen tracking system also was done through computer. Genomic surveillance was done through IT platform. So what I would like to highlight is that had it not been for technology, we probably would not have understood that trajectory, and based on which we would not have been able to analyze what needs to be done to begin with. And when it comes to managing any future health emergency, my submission would be only one. The question today for us is if the next health emergency will happen or not. The question is when it may happen. So we need to be prepared. And to that extent, we strongly believe that the technological tools which India utilized in its ongoing battle in COVID would be further strengthened to ensure that we'll be able to manage any health emergency better in future also. Thank you.
So that was how the government managed a crisis like COVID-19 pandemic. My next question is to you, Mr. Praveen Bist. Let's talk about the private sector now. You are a key and a very established player in Kerala, a state which has one of the best health infrastructures in India when compared to others, and one of the best healthcare services. You are also a key player now, becoming a key player in Delhi NCR region. You are a disruptor, giving a tough competition to the major established chain in this region. Now, what role in private sector? How do you think we can leverage technology for providing quality healthcare services to our patients?
Sure, thank you, Neetu. So just to update everybody, I am with Amrita Hospital, and we have opened up a new facility in Faridabad. The capacity is 2,600 bedded. We are not fully operationalized it, but yes, it is one of the largest facility in India. And we already have a hospital in Cochin, Amrita Hospital, that's been running for 25 years. So that was the background why Neetu mentioned that. So that being said, technology, as Mr. Agarwal also pointed out, is definitely the savior for us, right? We all can appreciate, understand, and we can see that technology is pretty much ubiquitous, right? Every single place, and so is healthcare as well. It's not, maybe it's a little late in the game, like financial services probably was adopting to technology much earlier. In healthcare, it was diagnostic. But going forward, we can see that the hospitals are utilizing technology at every sphere possible. For example, it could be a patient-facing application, right? So you talk about mobile apps for the patient. You can be a patient portal where you can not only see your reports. CoWIN is a great example, by the way, but each of the player, each of the hospital have their own app also, where patient can see their data. Also, it can be used to make appointment, it can be used to do teleconsultation, so on and so forth. So that is on the one side, which is a patient-facing application. Then at the back office side, it's more for, say, inventory management. It's a huge thing. If you're able to manage your inventory better with technology, definitely it results in a better patient service. So that is on the back office side, including billing systems. And then in the middle, which is not necessarily patient-facing, but more clinical. And that is where the focus is going towards, because India in general is lacking on that space. So you call it EMR, electronic medical record. We have seen that diagnostic lab, radiology, they have moved to technology much earlier, but now clinicians, be it nursing, be it doctors, physicians themselves, they're also adopting to that. And maybe COVID was a great reason for that. It was, a push, and also it broke the barrier. Earlier, there was this always doubt whether technology can, be used for, say, consulting. But yes, we have proven that. So now physicians, clinicians are definitely on board. And that is where the advent of EMR and the use of AI. So AI, as you just mentioned, is a very upcoming technology and very, very powerful. We all must have used ChatGPT some point or other, and it's just amazing what it can do. And only if we can adopt it rightly for the clinical side of things, it will be of great help. So be it pathology, be it radiology, there are very good use cases where AI is playing a great role, and going forward it will only help and it will improve going forward. And then lastly, if we use the technology rightly, the cost also can be controlled, and that can be passed on to the patient. So not only are providing a better service, but also you're reducing the cost overall. So that would be my point on technology.
Now I would like to loop you in, Dr. Vaibhav Kapoor. Now when we look at the healthcare system in India, what we see that majority of the hospital institutions, majority of the healthcare institutions, hospitals and qualified healthcare practitioners are concentrated in urban India. Now if we also look at the government data, it shows that around 70 to 75% of the hospitals are concentrated in metro cities. Now how do you think one can democratize healthcare in a country like India? And what is your company doing in providing quality healthcare services to patients in tier 2 and tier 3 cities?
Right. The other day I was having a discussion with sir only. Rightly we need more hospitals when it comes to tier 2, tier 3 towns. But also, I showed data where the existing supply, right, the existing mid-sized hospitals, they work at a 20 to 30% utilization capacity. So, new age startups or Pristyn, it's a 5-year-old startup. Our first aim right now is how do we ensure that the existing hospitals, work at their full capacity. Hence, we call ourselves asset light. So, being a doctor myself and having worked in the government setup, corporate setup, private setup, what we realized was when you talk about a 20-bedded or 50-bedded hospital, which is generally owned by a single doctor or a smaller organization, there are 3 basic things which they lack, and which new age models like ours are trying to help them in. The first thing was on the quality protocols, right? They can't have a NABH accredited full-time with them who can regularly train their nurses or OT technicians. So what we've done is we have a complete team of QCI consultants in-house. So whichever hospital we work with, we first send that team. They train the OT technicians, the OT staff, the ward staff, the paramedics into the latest protocols as per the NABH guidelines. So we know that if a patient is coming to a mid-sized hospital, he understands the quality of treatment is going to be the same. Second thing which we realized was that these hospitals will not have access to all the latest medical equipments, right? Because the medical equipments are costly, and as a single practitioner doctor or as a small organization, I might not be able to shell out that amount. So Pristyn invests into all these latest medical advanced equipments. So, now, since these equipments are mostly mobile, so when you buy an equipment, you can use it across multiple hospitals. Hence, the utilization of the equipment is better. So, what we enable is a patient, suppose he is coming for a kidney stone surgery, will be able to undergo surgery with the same latest equipment in a mid-sized hospital, as compared to when he has to go to a larger institute. Third step, what we realized was all the quality doctors, right? So models like ours, we work with full-time doctors, right? All the specialist surgeons, gynecologists, plastic surgeons, they all work full-time in Pristyn, and hence, we are able to utilize them better because, even the mid-sized hospital can say that they have a quality plastic surgeon, they have a quality aesthetic surgeon, they have a quality urologist coming in. So when we do this, we enable a hospital to provide the same quality treatment at the NABH level protocols and with a very high quality doctor, and it helps to increase their utilization capacity. So that is the first step which we are doing, and of course, when we do it at scale, like sir said, technology plays a very important role. I'll just add to what Mr. Bist said. Electronic health record, right? When I was doing my MBBS and MS, one of the most common reasons for medical errors was, doctor's handwriting a pharmacist was not able to read. Electronic health records have come in, doctors, sort of use it. This problem is almost gone, right? We don't see in our setup, we getting calls from hospital or from patients ki doctor ne kya likha hai, samajh mein nahi aa raha, because it's crystal clear. Very basic thing, but it leads to absolute safety, right? So for me, as a doctor, first thing I will say is technology will lead to safety, right? Now, since all the records, are, tech, you can put in markers, you can put in OCR technology, and you can immediately find out which are all the high-risk patients, and accordingly, you will sort of, ensure that high-risk patients are treated in a different manner than regular patients. So I think that is the first step. Second thing is telemedicine, like sir also said, everybody now understands the importance of telemedicine, right? One of the major reasons when we talk about equitable healthcare for all, telemedicine, you are 10,000 kilometers away from Delhi. You can just, you don't have to come to Delhi. You can talk to the doctor directly, take a second opinion, right? Teleradiology. We use a lot of teleradiology. Sometimes it's a complex case. A radiologist in maybe a tier 3 town is not able to judge it. They send the report to our metro, partner, and they are able to give the diagnosis. Again, teleradiology, tele-ICU, right? A 20 or a 50-bedded hospital might not have a full-fledged, ICU. Or they might have a ventilator and the support staff, but they might not have a critical care specialist. So a trained nurse and a tele-ICU, doctor guiding him, again, it plays a massive role. So that even a slightly high-risk surgery can be done in their own city just by using tele-ICU. So I think in our practical, approach, we've seen these 3-4 things massively help us scale things across India. And then, of course, there are multiple other things it leads to, collection of data. You can go on to do a lot of research on that if the data is corrected rightly. I think all these are there.
Yeah, so when what you are talking about, it's basically technology being an enabler. So we should also not ignore technology's role in pure public health play. So I would like to loop you in, Dr. Anirvan Chatterjee. You are a noted researcher, a data scientist. So we still see, we have seen COVID-19 pandemic creating a havoc, families ruined, lots of lives lost. So what role of technology do you see in preventing such future pandemics?
So I think Sir has already kind of laid out what was done, and I think what beautifully he said is it's easy to think that what was done during that period was a game changer, but it's more about what happened 20 years before that, and the nation was prepared for this. So now the question is, how do we get prepared for the next part when we already know that the chances of these infections and pandemics are increasing because of global travel. So if we take a step back and try to understand what exactly is the problem that we want to solve, the first problem is healthcare as an ecosystem is reactive. It is always chasing something, and in case of infection, as we say it, we are always chasing the bug. We are one step behind. Kuch hota hai, and then we try to react to that. It's like damage control. And that is what we need to change. We need to upend the entire diagnostic ecosystem, where can we imagine a world that every diagnostic test is not only being able to detect, but is able to predict how the infection is going to progress in the patient, because an infection in a patient progresses very, very differently. In some cases, this patient end up into ICUs and multi-organ failures. In many patients, it does not even show up. Can a diagnostic test not just detect what organism it is, but can it also predict how it will progress, how the clinical infection will progress? But can it also predict the epidemiology? And we have the opportunity to do that. In the world of science that we exist in, we have the opportunity. Let's take a real example. I don't think we are even at the place where we are talking about a hypothetical situation. When we talk about antibiotic resistance, AMR, antimicrobial resistance, it is right here in this room. While we are oblivious to many of these things, the fact is the rate at which we are losing antibiotics, one antibiotic at a time, we are getting to a place of superbugs where a simple infection can actually become very, very fatal. And we don't have too many antibiotics, and there are not much in the pipeline. At the rate at which we are losing antibiotics, we are not gaining antibiotics at the same rate. Now, if we want to start imagining a world where we can actually stop many of these outbreaks, some of the gains that we have made in COVID needs to be carried on. And specifically some of the things that Sir spoke about, genome sequencing. It is by far the world's greatest technology that we have seen in the past 20 years. The RT-PCRs that were created for COVID sequencing happened only when the virus was sequenced. The variants of the virus were sequenced. Now, if you see the time lapse between the first infection that it gets reported in a hospital to the time when it is first flagged as a fever of unknown origin, to a time where it is decided that this is a coronavirus, it is SARS coronavirus 2, it is not the MERS, it is not the first SARS. This entire science is available, but the time to discovery is delayed, and that is what we can scale. Can we imagine a world where every infection is detected by genome sequencing? It's incredibly expensive. It's probably one of the highest forms of science we know, because to do genome sequencing, you not only need an understanding of molecular biology, you need to understand microbiology, virology, computer science, data science, and AI. But if we imagine a world where every infection can be detected by genome sequencing, we are talking about a technology which is democratizing discovery. If we can democratize discovery beyond just detection of a pathogen that I know, we are enabling an ecosystem where all of these technologies which are already existing in say, the ICMR or the NCDC of the world, we are looking at a place where we have the ability to actually detect even before an outbreak happens. So there is an outbreak that may progress into a pandemic. Today, we are at that stage of antimicrobial resistance. Today, we are in there are places where vancomycin resistance is prevalent. There are places where colistin resistance is prevalent. If we can manage antimicrobial resistance today, we have an opportunity to actually prevent that pandemic. So the question that you have asked is not hypothetical. It is a real and clear present danger today. And I think some of the advances that we have made as a nation, as a society, and as a healthcare fraternity, if we can scale that using technology, that will be a tremendous world where every infection, every patient is treated better because of better diagnosis, but each such diagnosis is helping in epidemiology, which is a continuous dashboard wherever it needs to be.
Now the technology is already there. Government of India has already rolled out a lot of technological solutions, as I said. So now how Government of India is trying to integrate technology in the total healthcare ecosystem?
This actually is a very interesting question. You know, if we see historically, Ministry of Health collectively, including also states, we had actually been taking a lot of digital health initiatives. And over a period of time, we realized that while India has done exceedingly well in terms of using technology, parallelly we realized that all these softwares don't talk to each other. And that is where you realize that whatever problem which we have in the physical space, lack of communication between human beings, we had effectively translated it also into the cyberspace, something which I call egos of the softwares. The need of the hour then has been to focus on ecosystem approach. And that is where I would like to highlight that around 5 years back, Government of India came up with the National Digital Health Blueprint. And that blueprint became the basis for launch of Ayushman Bharat Digital Mission. What is very critical is that when you get data, and if you can plot that data longitudinally, something which you call longitudinal electronic health record, the insights which it throws actually saves a lot of money to a patient, avoids repeated diagnostics, and facilitate precision medicine. let me compliment you for highlighting the fact about not only AMR, but also the fact that the drug discovery also in future will be facilitated by technology. Artificial intelligence, generative AI, there are case studies which are happening across the world where we are trying to use generative AI to actually speeden up the process, what could the probable mix and match of combination of drugs which can be useful. So thinking that as an approach, what we are doing is that we are actually creating an ecosystem approach, an architectural approach on digital health usage in the country. And I'm happy to highlight, yesterday, Honorable Minister of Health from Tanzania was visiting our control room, which we call National Public Health Observatory, where the digital data across multiple programs are collated, whether it is blindness, whether it is disease surveillance, whether it is happening because of TB or any other communicable diseases or maternal child health, the whole data gets collated, coupled with the financing, coupled with the health infrastructure to come up with those insights which actually become the driving force to drive policy on the field. So I think from our perspective, what is very clear is take the full advantage of data, break the silos of the system. And as part of that process, this Ayushman Bharat digital mission will be a game-changing event for this country.
Okay, since you are telling us that a lot of other countries have also shown interest in our technological solutions that you have recently rolled out. But these mammoth tasks don't come without challenges. So what kind of challenges have you faced or are still facing in implementing these technological solutions in a country like India, where we talk about rural India having network issues and all that? How are you facing all these challenges, and what are the ways you can overcome this?
So actually challenges had always existed. You know, you surmount a challenge, but again you realize that another component technology offer another interesting solution, and for that there's another additional challenge to be managed. So to that extent, challenge will remain a continuous engagement process where new technological tools will be developed, surmounting those new challenges or new insights which can fall in place. But if I were to highlight what could be those generic challenges which always will remain our focus area. So the first and most critical challenge would be basically to control this cycle of epidemics of pilots and create an ecosystem or an architectural approach. If you see a lot of international organizations, a lot of states, multiple times we basically launch a pilot, the project gets over, the technology loses value, and then again it is business back to user. So what we are saying is that when you actually take up a technological innovation or a technological tool is put in place, please think of it to begin with where it is going to be used and what is its sustainability framework. And where does it fit into the overall Ayushman Bharat digital mission infrastructure? Based on which, once you have launched something, after that, how does that, whatever framework you are adding, will basically be put for public health policy. I would like to just give you one simple example. Artificial intelligence, people were talking about it. I knew a lot of organizations are working on artificial intelligence. But my biggest agony was that whatever they would do, they would not even discuss at times with government, and they'll create a solution which probably is not my priority today. So then what we did is we created this concept of digital public goods, and in ministry I have an embedded team working on artificial intelligence today, where before picking up a solution, we take a decision where it is going to be put to use and to taken to scale at national level. Example is telemedicine eSanjeevani. Now in eSanjeevani, triaging is done through artificial intelligence. Second example is when I am doing disease surveillance in the country today. You talked about early insights. 11 languages across the country are monitored through artificial intelligence tool for any media coverage of any identified 36 diseases, and I pick up those cues and straight away send them to district to react. So how do you basically, whatever you do, become a framework for nationwide expansion is what we are trying to work on. And another challenge in terms of, to that extent, you need to focus on capacity. To that extent, you also need to come up with those low bandwidth solutions, which can actually work without requiring too much of bandwidth. And also you need to create this framework where we remain oriented and we remain agile to the fact that if there is a new tool or new technology which is coming up, let's talk about generative AI. Am I responsive enough to actually integrate into my health system? would become another critical ongoing task which you would need to focus on.
Dr. Vaibhav Kapoor, would you like to answer the same question? What are the limitations that you see in implementing technology solutions?
I think sir has covered most of them. Again, over last 5 years, what we have seen, the challenges when we have went with our systems to the hospitals, particularly tier 2, tier 3 towns, what we realize is, first and foremost, the most important thing is it has to be affordable or free, right? If it is not affordable, no one is going to use it. So I think that is the basic thing that you have to, when you launch your product to the market, you cannot charge a premium just because it's a new technology. You have to make it extremely affordable. How you do it, you have to figure it out. Second thing which I realized was that it has to be very, very easy to use, because it's not the promoter of the hospital who is going to use it, but it's the patient, it's the paramedics, the nursing staff, the ward staff, the OT staff which is going to use it, which will probably be graduates, right? And it has to be very easy, probably just like WhatsApp. A couple of clicks and the thing is done. The moment, you have 7-8 clicks to do, and they have to go to a different phase, they'll just not use the technology. So in fact, we probably, got our hospitals to adopt it probably in version 5, when we realized just 2 clicks and the things are done. Because if the nurse has to do multiple things, it's very difficult for them to adopt. So how easy technology you can build, and it was directly correlated to its adoption. Another important part I feel is, which sir mentioned, the technology has to talk to each other. So what happens is, inside a hospital, sometimes a laboratory is not talking to the OT or to the OPD center. So patient, actually the reports are on the app, but patient needs to take a printout and then go to the other place to show the reports. The whole purpose gets defeated. What we realize is the limitation is, like sir said, not all the systems are talking to each other. A bigger problem is when you go to a different place, a different location, a different hospital, both the technologies don't interact at all, because they're using completely different tools, and hence, something like ABDM, where the M1, M2 integrations are coming up, they become extremely critical that technology has to talk to each other.
So how do we address those challenges?
I think it will take time. Like sir said, people have to be more responsive. A lot of people risk, my data will go to a different, hospital, and it risks my patients. I think we'll have to rise above that, and, because it will happen. It will happen with some resistance, it will happen with more resistance, we'll have to see that. We have to have a UHID sort of a system, because that's the only way we can do it. One last problem which I felt is, where, of course, a lot of government help is also required, is acceptance of this, right? For example, you launch something, the paramedics, the hospitals adopt it, but suppose the insurance is not ready to adopt it, because then ultimately all the systems have to talk. For example, people use a lot of electronic health records, people use HMS systems, but if you have to have an insurance claim, a physical copy of the file is mandatory to send, because that is insurance protocol. Now everything in the hospital has done electronically, but then you have to take the printout and send it physically to the insurance. The whole purpose gets defeated, because insurance doesn't accept, the digital copy. So I think these are a few challenges which we see on practical basis in every day, and I think these are the things which will have to improve over time. Yeah.
Now, okay, let's assume that we integrate technology in our healthcare systems. We also make these healthcare services available to our patients in tier 2 and tier 3 cities. Now, in a scenario when India does not have a proper data protection law, Mr. Praveen Bist, I would like to come to you on this. In a scenario when we don't have a data protection law, what hospitals can do in preventing cyber attacks, like we have recently seen done on AIMS, ICMRs, so many pharmaceutical companies have also faced this problem. Now, what can we do to prevent cyber attacks and to keep intact the patient privacy and data security?
So, very good question. Just before that, if we don't have a good consolidation of data, then the the threat is very low, because what will they do even if they get access to the data? There is hardly much there. That's on the lighter side. But yes, cyber security is a very important topic. As we move more and more digital, more and more transactions online, then obviously the chances that somebody is going to misuse it is also going to be equally there, right? So how do we kind of detect that threat? How do we respond to that threat is a very, very pertinent question here. And we all know, आजकल TVs में सब जगह आता है, OTP में share करिए, password make it strong and all that. So those are all like very, very basic problems that we can potentially face, which can be easily prevented. But then it's a basic 20-80 rule where 80% of the problem can be easily resolved. But it's those 20% which can be really devastating, right? It can actually harm the entire organization. So having said that, there are a lot of tools available in cyber security. Get into the too much details. We have, it's towards the end of the day, and I don't want to have a long spiel on technology, but there are products, but they're expensive. There are SIEM products, security information event management. There are SOAR, security orchestrated automation and response. So there are multiple of these systems that are available, but one, they're expensive. Second, you need expertise to even use the system, even though with the AI, things are becoming easier because you need less resources, and machines are able to do what manually you would have done. But then still, there are resources that are required to implement these solutions. But going back to talking about integration, I just want to share one funny story. This was way back a few years ago when I was working in the US for one of the big healthcare system. So that time US wanted to move from ICD-9 to ICD-10. So that was a big talk of the day. So one of my colleagues were very lightly saying that, "Arey, India में तो हमने पहले ही से ICD-10 adopt कर लिया." But the challenge was in India, even though we say we are adopting, but we don't necessarily use it. So change करना में बड़ी बात क्या है? Instead of using 9, you say I'm using 10, but actually nobody is really using. But versus in the US, everything is driven out of ICD-10. So coding is very, very important, and that is one way to bring everybody on the same page. We have to use systems which are more standard driven. So be it ICD, be it drug database. अगर दो different hospitals same patient के लिए दवाई लिख रहे हैं, but with a different name, it might actually be mapping to the same generic molecule, unless and until we realize that our system will not be able to do of much help. So that being said, so technology is a way to go, but then there are threats which we have to accordingly plan to fend ourselves with. Thank you.
So let us talk about some innovations in technology in terms of healthcare. Dr. Anirvan Chatterjee, would you like to share some new insights on new innovations being happening in healthcare system?
Sure. So at Haystack Analytics, we work on two very interesting diseases. One is tuberculosis, and the other is bloodstream infection and sepsis. These are not two topics that generally startups should take up in India. They're not very glamorous. I'm not saying people don't do it. But we are in IIT Bombay, and we are supported by BIRAC and the Department of Science and Technology. And it has been an amazing journey because as a researcher at University of Oxford in 2015, when they launched genome sequencing as a diagnostic method for tuberculosis, the question that I was asking myself is, this is required in India. And with the support that we have received, I'm really fascinated by how the entire ecosystem has come together. We are now working very closely, trying to engage with ICMR, both on tuberculosis drug resistance testing. We now have the ability, we have actually piloted drug resistance testings for 18 antibiotics in a single test using whole genome sequencing, which is actually costing lesser than microbiological testing. So we are able to do genome sequencing and provide reports at almost 50% the cost of what it would have taken to do it in microbiological culture media. And with sepsis, what we have been able to do is we are now taking genomic solutions to every hospital. So what we believe at Haystack Analytics is, as I was saying, every hospital should have access to clinical genomics, starting with infection. And what we have been able to do, more than 40 diagnostic labs in hospital now, just in a year, we have been able to take genome sequencing, which can detect any bacteria, any fungi, and antimicrobial resistance in a single genome sequencing test direct from sample in less than 12 hours at a cost which is lesser than the current microbiological investigations. This is what we are invested in at Haystack Analytics. We are supported tremendously by a lot of the government work that is going on, and I look forward to bringing this technology. We're already in tier 2. I just came from Raipur yesterday, and we have launched the universal ID infection test for bloodstream infections in Raipur. And with the support that we have, and there are clear indications that we are seeing that the entire ecosystem wants to move towards better technology, and we should be able to do that. I think genome sequencing as a technology where we have enabled AI and big data can actually transform a lot of the problems that India has, and we are ready to solve our own problems.
Oh, those are wonderful insights. I would like to come back to you, Mr. Praveen Bist. You are probably the best person to answer this question. We all have seen the traditional ways of healthcare services, service delivery, and we are also now seeing the cutting edge technology seeping deep into our system. So how do we transition from this old age technology to the new age technology driven healthcare solutions, and how can we smoothen this process?
So I think the technology is more and more the foundation of any industry for that matter, right? Not just healthcare. And just like foundation, it's not so easy to change the foundation. Once you have built a building, on the foundation, it's not that easy. But then technology is, a lot of it software driven, and software is easy to upgrade. So that is the plus point with that. But technology, when it comes, the selection of technology is very, very important. And like Mr. Agarwal just pointed out, India has done some fantastic work to have application scale, and which talks about one, its right architecture, and also it's very easy to use. Those are the very, very fundamental key points. Unless and until you keep those in perspective, you may not adopt the right technology, right? So one is that. So once you adopt the right technology, the second is the implementation of it. Implementation is equally important. In fact, I was surprised to read that most of the IT projects, fail not because it was not the right solution or right technology that was selected, but the users were not involved at the right time. Unless it is their interest is taken care of, their buy-in is into the whole project. That is also very, very important. So I think it's a multifaceted perspective that we need to look at before we decide on any technological solution embarking.
Now India is riding on a digital wave. And G20 also, if we see, technology is another major issue that we are discussing about. Now, I want to talk to you, Mr. Love Agarwal, on this, that about digital agenda of India's digital agenda. Basically, it is not within the country, but it is from across the globe. So what are the ongoing efforts in this direction from government of India?
First is, a lot of people call me doctor. I wish you can also give me a degree.
Apologies for that.
So, no, I feel happy about that because doctor is a very respectable this thing, but I also see time's up. So my only request is I'll just be very brief, just to highlight not only driving the digital health agenda in the country, India is actually the main driver for digital health globally today. The digital health resolution in WHO was moved by me in the year 2018, and that became the reason for WHO actually to have a digital health and innovation department to begin with. And that became the reason that now WHO has a global digital health strategy. Not only that, the biggest intergovernmental body working on digital health, global digital health partnership, India had been chair for that for 2.5 years, and we handed over our chair last year to United States to take over from us and develop it further. This is 36 country partnership for which I was the chair, and we were driving global digital health agenda. Be it SNOMED, be it any other such interventions. In all these interventions, India is probably having the biggest role to play. In terms of G20, Out of the three defined priorities, one of our specific priorities, convergence of digital health efforts and innovation to achieve universal health coverage. And I'm happy to highlight that India proposed that all the global digital health initiatives across the globe need to converge to come out of this duplication and silos and work together so as to create an integrated bigger picture. And for that, we proposed a global initiative on digital health to be launched. And I believe that in next few days down the line, you will hear a news that it is because of India, a global initiative on digital health, which will integrate across the system, across the globe, all digital health initiatives and promote the concept of digital health as public good, being made available free to lower and middle income countries, wherein we will actually, the word which was used, the democratization of technology. So this whole thing will be driven by India, and I'm sure that, across the world in the digital health sector, it will be India which will be defining the agenda for future to come also.
What an interesting and brainstorming conversation this has been. And this can go on and on for an infinite time. However, before wrapping up this session, I would like to open the floor for any question and answers. And in any of our audience want to ask anything from our esteemed panelists or gentlemen. Can anybody hand over the mic to him, please?
Thank you for taking my question. My question is for Shri Agarwal ji.
Please identify yourself.
Dhruv Kapoor from Claim Therapist. Sir, my question is that price discovery for across hospitals is still an area that requires a bit of attention. It's not like, the discovery still happens in a very manual method. Is there a stance from the policymakers to make this transparent, to make it available for anyone who's seeking price discovery at any given point in time, especially in healthcare, during medical emergencies or in planned cases as well? That's my question, sir. Thank you so much.
Let me just understand, what do you mean by price discovery here?
So if I'm to get hospitalized, what would be the cost for my particular this thing? So lack of a better word, should there be a make my trip for over the next decade? Should there be a make my trip for price discovery across hospitals? Will that make life a lot more easy?
So, you have one of the entrepreneurs sitting here who is actually working on similar such model, and not only Pristyn Care, I believe there are a lot of other initiatives which are happening across the system. See, we have discussed about it multiple times, and we realize that in terms of pricing, there cannot be uniform pricing when it comes to all component of health sector. There can be certain component which can be, price controlled, and you are aware, but there are certain places where price control cannot be the only solution or the best solution feasible. And that is where, like, for example, I keep giving this example, if an operation is done by a senior doctor, he will end up charging more than a person who's a junior doctor or a less known doctor. All you need is to focus on transparency within that. I think the biggest challenge for a consumer could be that once a price has been indicated to me, the price should not change. Or if it is changing, it should change with a reason. There is a very positive action which has actually happened. Because we come from a relatively affluent section of the society, we probably don't take advantage of it. But let me just cite to you that the world's biggest health insurance scheme, Prime Minister Jan Arogya Yojana, is actually the classic example of working on costing and ensuring uniformity of costing across the private sector and the government sector on identified secondary and tertiary procedures. So more than 1,000 plus such procedures, they're all costed in advance, and they all are monitored through a digital software across the country, across all the empaneled hospitals by National Health Authority. And this is something which gets done for 40% of the population across the country, which is eligible under PMJY. So good things are happening, more things need to be done, and this will always remain a work in progress. Thank you.
One last question from that gentleman. I think he wanted to ask something. Please identify yourself.
Myself, Dr. Adil. Being a doctor myself, I've seen few of my friends being tech averse. So my question is for Dr. Vaibhav. He said you are bringing new technologies in the tier 2 hospitals. So I would love to know what kind of technologies are getting adopted. And I have a follow-up question for Mr. Praveen. Like what kind of technologies are being adopted in tier 1 hospitals like Amrita hospitals?
So see, there are different aspects to it. One is, like I said, if you talk about a doctor, right? A doctor, in our case, whoever doctor is there in whichever city he is there, he has a mobile app, which is a doctor app where he can see all his appointments for the day, where all surgeries he is going to do, which all follow-up patients he has to see. He can even make his OT notes, discharge summary, add medication, delete medication, everything on his app, right? So that is one thing. So he doesn't have to go to that room or the ward and fill it there. He can, if he's sitting in the OPD, if he's sitting in his clinic, even if when he goes back home, he sees a report, on his app, and he needs to change a medication, he can do it on his app, and that will be, coordinated with the hospital. Now this hospital, this doctor app system is talking to the hospital app. Now inside the hospital app, there are multiple functions. There will be an OT, there will be a front desk, there will be a nursing staff. So every detail, what a doctor is asking for a patient, or patient, doctor wants to receive the details of the patient, the hospital uses the hospital app there. So the doctor app and the hospital app are talking to each other. Then we have a patient side app, just like a Swiggy or a Zomato, where you can see what all things are happening with you, right? So a patient can see, okay, his OPD is done, his diagnostics are done, his surgery is planned, these are the further things which have to be carried on. So all those things happen. So a patient, all these things have to talk to each other. That is the most important thing. Yeah.
Thank you so much for being a wonderful audience. We would like to wrap up this session. Mr. Love Agarwal had to go. He had an important meeting. Have a great evening ahead. Thank you so much.
I can talk to you by the side once this is over.
Can we get a picture together? Yeah, okay. He'll be back for the picture. So much for being the first, and probably if the fashion continues, you'll probably be the last person on the dais as well. But thank you so much for being so kind and joining us here. We have Mr. Bist, Dr. Kapoor, of course, is coming back. Dr. Chatterjee, thank you so much. Ms. Sharma, thank you once again. And of course, Shri Agarwal was here as well for the last. With this, I think it's fair to say that it has been a fabulous day throughout, with some wonderful conversations and some key insights on some impertinent and very imperative topics throughout the day. So once again, thanking all of you for being here with us. All the audience members, of course, we'd like to extend our gratitude to all our speakers throughout the day. And this was not possible without our partners, goes without saying, powered by our partner Whistle, Diamond Partners, Amazon Pharmacy, Practo, Pristyn Care, Tata 1mg, our bronze partners, Policy Bazaar, Haystack Analytics, and all our exhibitors. Thank you so much for being a part of IAMAI Digital Health Summit 2023 on behalf of the whole family of Internet and Mobile Association of India. We're looking forward to host you again in 24. My name is Raven Kundu. I was your host for the day. It was truly a pleasure. And thank you so much for sticking around till the end. You guys are fabulous. One last time, a round of applause for all of you for being a fabulous audience. Thank you so much for being here with us. Don't forget our hashtag, right? Use the hashtag, spread the word around, and to collect all the pictures, you can go to our social networks. LinkedIn is there. You can get the pictures from throughout the day, the fabulous sessions that we had. Enjoy the rest of the evening. Thank you so much. God bless you all.